So, patient comes to you and says, everything is fine. I'm not having any issues. My physical health is awesome. My mental health is awesome. But when you look at him, he's going like this, and he's looking at other places out other than you, the one who's assessing. He's going like this. He's turning his head while you're talking to him, and while he's talking himself, he'll go like this. Distractible. I mean, what would you do, right? So when a patient presents like that, they are not telling the truth. Perceptual disturbances, hallucinations, a patient can deny and deny and deny, but when they're objectively, you can see that their eyes are looking and deviating from contact, especially if they're kind of like doing this whisper over there, or their mouth is moving outside of speech without sound, or they're turning their head somewhere, or they're distracted up in the ceiling. It's usually very indicative of perceptual disturbances, hallucinations, sound, audio, visual hallucinations, or gustatory hallucinations. Sometimes patients will say, I taste iron or metal in my mouth, but they don't have anything in their mouth, right? So when a patient is lying, minimizing their symptoms, there has to be, first it's going to have to be safety, right? Withdrawal-induced psychosis, delirium is very real. So there has to be a lot of education for it. A patient will want to refuse medicines. They'll want to refuse care. They won't want to go to therapy, etc., etc. The best thing that you can do is continue to educate them that this is what they're presenting. This is what you look like. So if I was talking to a patient, well, we're talking here, but, I noticed that you're turning your head away from me. What's more interesting on that side compared to our conversation, right? So whenever you're presenting the patient's symptoms to them, a lot of times they won't really be as mindful of it. It's very hard to hide hallucinations or being distracted by hallucinations from the actual person who's assessing them. So you have to tell the patient, I noticed that you are looking at the ceiling. What's in the ceiling? My patient today escalated verbally, and you can tell when they're escalating, their voice gets louder, their fists clench, they start turtling. This is called turtling, and it's a defense mechanism that people subconsciously do. This is turtling, and when people do this, the turtling, it means that subconsciously their physical body is trying to protect their carotid arteries, and when that happens, they get very tense. People who are very defensive and have anxiety or in a fight or flight state, they tend to close their legs a little bit more. They tend to guard their core like this. So they'll start to cross their arms because they're being very defensive. So those are the things that he was starting to do. So when that happens, I told my patient to, hey, let's take a minute. I want you to step out, take a breather. Because when somebody's escalated like that, you actually have to take them outside of the situation. They have to be isolated from a group of people. They, just tell them to take a breather and we will reassess or what have you. But in psych and working with psych patients, it's always going to have to be safety first. If you feel like you're in danger, you yourself as the practitioner or as the nurse, you have to step away from the situation. Also, you always have to place yourself in the position to where you have the closest access to the exit door. So you don't ever want to be in an environment or a time to where the patient is between you and the door. So those are things that you as a psych nurse, a psychiatric nurse practitioner, you have to notice. But yeah, a lot of tension, escalating, de-escalating techniques. Also telling the patient, like, I noticed that, your voice got loud as we were talking about this topic. Tell me what's going on there. And the patient's going to be like, I don't want to talk. Unfortunately, this patient was very closed off. He's just like, I'm fine. And he started escalating and escalating and escalating. So, yeah, I mean, that was my day today. A lot of fun today.